Hi, my name is Pravallika Srusti, and today I would like to discuss neuromonitoring and the role it plays in dementia diagnosis, monitoring, and treatment. And I want to specifically look at this topic because in our class we have looked at intraoperative neuromonitoring, but we've also very briefly mentioned the role that neuromonitoring plays in the clinical setting. So I wanted to look at that and look at the progression of the use of neuromonitoring throughout, the beginning to end of kind of understanding and treating a disease. So, for example, in this case, dementia and just like the general dementia. So, before we get started, I want to kind of go over what dementia is, right? And so when you think about dementia, you think of memory impairment, you think of cognitive issues, right? And that is generally what we are looking at when we talk about dementia. So it is associated with abnormal memory loss and cognitive deficits. And dementia itself is not necessarily a full-blown diagnosis. It's a very broad umbrella term, and it includes a lot of different diagnoses that fall under this category. So for example, some of the common ones you might know are Alzheimer's disease, frontotemporal dementia, vascular dementia, Lewy body dementia, and so many more, right? And there's a lot of common signs and symptoms like forgetting things, inappropriate social behavior, difficulty for performing familiar tasks or remembering familiar things, like forgetting a path to school or something that you've known forever, or very large personality changes. And something you'll notice is that a lot of these symptoms are very broad, right? They're very broad neurological symptoms. And so that's why dementia itself is such a broad umbrella term because it's something that there's so many different symptoms that could occur. And there's so many things that are so very broad that you would need to go through a lot of different testing in order to come to the conclusion that this is dementia, not something else. So let's go over that testing really quickly. So the current diagnostic criteria that we're looking at for dementia often follows a few different necessary tests and procedures, right? So you start with the medical history and the physical exam, and this helps establish your symptoms and rule out any other health issues that may cause similar cognitive symptoms to dementia. This also includes a neurological exam, and this can help rule out things like, something like a vitamin deficiency or something like that, where it's quite easy to get treated for that quickly. And you might be able to see a much more rapid change. Along with that, you also have a lot of cognitive and behavioral testing, which helps evaluate your current cognitive functioning and look at the disease progression. So where exactly are you if you have, let's say, Alzheimer's disease? Like at what stage are you at? Are you at a much further, like fully dementia stage, or are you at a point where you have some cognitive deficits, but not fully, you're still able to independently function? So that's very important there. Along with that, brain imaging is very important in order to rule out structural causes for these cognitive symptoms. So for example, if you using MRI, CTs, and PET scans and whatnot, you can look at things like finding strokes or tumors or something along those lines that's able to, once again, maybe not be easily fixed, but once you fix it, you're able to see a very quick relief of these symptoms, right? And then you also have CSF and blood tests, which can often help with finding certain protein biomarkers associated with Alzheimer's and other forms of dementia, such as like the tau protein or amyloid beta, which those clusters tend to be very well studied and associated with certain forms of dementia, and even with certain where those clusters may be or the amount that you may have in your CSF or blood, you might be able to tell, kind of like specify, but again, there's much more into that. So let's also look at neuromonitoring and dementia, right? So this is once again a very new and kind of explored topic, but I want to look at three common neuromonitoring techniques. Um, so the first one is going to be your EEG or electroencephalography, which we went over in our class. And this we're going to look at as it plays a role in the diagnosis of the disease, right? And also the diagnosis of which specific disease, not just dementia. Is it Alzheimer's? Is it, vascular dementia? Is it Lewy body dementia? We'll go more into that later. I also want to look at near-infrared spectroscopy, which we haven't discussed in our class, and the role it plays in both diagnosis and monitoring of disease progression. And finally, I want to look at deep brain stimulation and the role it plays in the treatment of the disease. This is also something we haven't explored yet. But before we get into everything, I want to go over what exactly near infrared spectroscopy or NIRS and deep brain stimulation or DBS are, right? So near infrared spectroscopy is, and again, this is very brief, very broad, very brief, but it is a measure of brain oxygenation by using near infrared light to measure brain function, right? And the reason we use it for dementia is, first of all, because it's very non-invasive and much cheaper. That's always something we're looking for. Along with that, as we said, it measures brain oxygenation and metabolism, which can't be provided with other imaging to the extent in the way that the NIRS is able to. So, for example, you're able to use NIRS while the patient is moving. It's much cheaper. It's much more accessible. Which is much more helpful. Along with that, it also might be more helpful in detecting dementia much earlier than other scans and measurement tools are able to. Along with that, deep brain stimulation is going to be a practice in which you stimulate electrodes in the brain for treatment purposes, right? And the reason that we would use this for dementia is that it's much more cost effective, again, than other treatment options, especially for the effect that it gives. It does show slowed cognitive symptoms due to treatment over time, but we'll go more into that later. And along with that, it has shown less atrophy of the hippocampus. Right. And so now I'd like to look at the role of EEG in dementia, and specifically in dementia diagnosis, right? And so the paper we're looking at by Mechanovic and Powell, um, we've noticed, and again, this is all very broad, but they've noticed that with the use of EEG, there are specific wave patterns that are associated with specific types of dementia. So, for example, they've looked at four different types of dementia here: Alzheimer's disease, Lewy body dementia, vascular dementia, and frontotemporal dementia, right? And so let's start with Alzheimer's dementia. One thing that they noticed is that there's a lot more slow wave activity in Alzheimer's disease, along with Lewy body dementia, actually. Both of them have a lot more slow wave activity than the control groups. And specifically for Alzheimer's disease, they noticed delta and theta waves, so they did notice more theta waves. And Lewy body dementia, they noticed a lot more delta wave activity. And they also recognized that some of the delta wave activity could be indicating more severe disease progression. Right. Along with that, with Alzheimer's disease, they noticed that younger patients tend to have more abnormal EEG readings than older patients. With Lewy body dementia, they noticed that there's a lot less alpha activity compared to control groups. Um, and now looking at vascular dementia or multi-infarct dementia, they noticed that abnormal EEGs are a lot more common. And when associated with cognitive testing, so in this case, it's a Hachinsky ischemic score, it becomes a lot easier to localize where this disease might be progressing in the brain as well as the disease progression itself, right? And with frontotemporal dementia, they found that it's not very significant or useful in diagnosing or monitoring FTD. But again, a lot of this research is new. And so, not necessarily new, but like still being explored. And so we can learn so much more in just a few years. We never know. Along with that, I want to look at near infrared spectroscopy, NIRS, and its role in dementia. In this case, it's both monitoring and diagnosis, you'll notice. But one thing that the paper has shown by Butters et al. Is that NIRS is able to differentiate between mild cognitive impairment and full dementia symptoms. So before we get too into it, I do want to explain what mild cognitive impairment is and why that is different from dementia as a term in general, right? So mild cognitive impairment is going to be um, the early stages of dementia. So you know how we talked about the protein biomarkers, right? And the structural changes in the brain. Those are going to be the first things that indicate dementia diagnosis or whatever is going on. Then you have your cognitive symptoms, which show up a bit later. And before you are full blown in dementia, where you are not able to take care of yourself, you have mild and cognitive impairment, which is an early stage of dementia, in which the patient still has mild symptoms, but they haven't progressed to the cognitive and memory impairment associated with traditional dementia. And they're still able to independently take care of themselves and function, right? And so this is so important because it's so necessary to be able to diagnose somebody with dementia as as early as possible with whatever dementia they might have. It's so important to diagnose them as early as possible in order to be able to slow down these symptoms. There's no proper full treatment per se for dementia that has been like 100% set in stone, but it is very valuable to be able to prolong the healthy cognitive state for these patients before you get to the stage of full dementia. So this can be very useful in that. Along with that, we're also noticing that the resting state oxygenation of the brain is lower in these prodromal or like mild cognitive impairment patients compared to the controls. And during word retrieval tasks, patients had lower hemodynamic responses. And so, for example, when they are doing a lot more cognitive work, for say, with these word retrieval tasks, when they're using a lot more neural functioning, they had a lot less um, oxygen allocation to the areas in which they would need more activity, basically. Again, very broad. That's not quite as in depth, but like in a general idea. Um, and now looking at deep brain stimulation and dementia, um, when we're looking into that, I want to first, since we're looking at the treatment of dementia, I want to first explain how the treatment is measured. So in this case, the measurement criteria is going to be certain cognitive tests. And the one that I especially wanted to point out is the Clinical Dementia Rating Scale Sum of Boxes, which is the test that for a lot of the significant findings has been the one with the change. So, for example, when we go into the targets, right, when they're doing DBS on the fornix, this originally started off as a treatment for obesity, right, and for depression, things like that. But the first time that they found some sort of memory change was through obesity treatment, and they found that the patient had improved memory and cognition as they received the treatment, right? And so they replicated these studies on patients specifically for Alzheimer's disease. And they found that there's a lot of mixed results, right? But they did find more effectiveness in patients above 65. So for the cognitive decline. Along with that, they also looked at the impact of deep brain stimulation on the nucleus ocellus of Maynard, and they found that when they originally tried it, there were no improvement of cognitive symptoms. Regardless, there has been more replicated studies, and they found very mixed results. Once again, nothing concrete. And with the ventral capsule and the ventral striatum, um, and there was actually only one study on this in this paper that's being referenced. And they showed that there is slower decline in cognitive symptoms, at least somewhat significantly, for patients that underwent deep brain stimulation to the ventral capsule. Um, and so again, these are all kind of determined by, you'll notice that in the paper for the significance, you will find it through the clinical dementia rating specifically, though there are a bunch of other um, tests, cognitive tests that they have went over. Um, Ultimately, here are all the references that we used. And thank you so much. I hope you have a little bit more of a better understanding of the role of neuromonitoring in the course of dementia. Thank you.